Good afternoon, ladies and gentlemen. I'm not a doctor, I'm a first year medical student. Yeah.
First year student.
All of us know that approaches to teaching correlate with the quality of learning, and knowledge of anatomy is a foundation for surgical skills. And teaching can improve by visualization, and dissection on the cadaver population which is dwindling is cannot achieve in totality. Laparoscopic surgery videos are easily available and very good as visual teaching aids. This study was aimed to evaluate the utility of laparoscopic surgery videos in teaching of anatomy. The methods: 100 students of a top-ranking medical college in India holding equivalent ranks as per the results of a national entrance examination were randomized into control group, which continued learning through established module, and study group, where laparoscopic surgery videos were incorporated in lectures within the same study hours. No additional resources were recruited as the laparoscopic surgery videos used were the routine recordings in operation theatres. Examination marks and grades were the primary endpoints. Improved motivation, help in revision, drawing, group discussion, and attraction for a career in surgery were noted as the secondary endpoints to indicate the desirability of laparoscopic surgery videos as a useful teaching aid. The results were that students in the study group scored better than the students in the control group in a preliminary semester test, and improvement was seen both in the theory as well as the practical scores. 4% students thought that laparoscopic surgery videos were a burden, but overall results of students' perception and adoption of laparoscopic surgery videos concept were highly encouraging. This is the table. 92% think that they are very good teaching aids. And I'll conclude by saying that laparoscopic surgery videos can be a good, useful tool for learning of anatomy, as shown by both acceptance and performance of medical students. And they also have potential to enhance the appeal of surgical career. Thank you.
Thank you very much. Nice presentation. So paper is open for discussion. Any comment or discussion or advice? Yeah.
I'm Melvin Fritz from US. How the students were selected? There was like a selection process to pick the students, wait a second. There was a selection process to pick up the students. In what years they were selected? First year, second year?
All the first year students, like later first year students, and they were randomly selected by the department.
Yes, Soper from Chicago. I too really liked your presentation. It was excellent. I had a question as to the nature of the videos. Were they highly edited, 10-minute videos of a long operation, or were they unedited videos? And did you try to point the videos to certain aspects of their curriculum? For instance, if in anatomy they were learning the anatomy of the stomach, would they be stomach videos? And if they were learning anatomy of the colon, were they colon surgery videos? That sort of thing.
No, they were the usual gallbladder videos of laparoscopic paralysis technique done by my dad. He's a surgeon. They were edited.
Hi, Alan Grant, University of Toronto. It was a very nice presentation. I was just wanted to ask you said that there was an improvement in the performance, those who got videos. Were you actually able to measure that or get test scores and compare how much they actually improved?
No, the average scores went out for the study.
But you don't know by how much, just
I cannot work stand-up because this is for the first time I can see a first-year medical student presenting in the World Congress. I must give you a big clap again. Thank you such a wonderful thing. And this is wonderful, but at the same time I would like to ask you one question. This video did have some audio input from your dad. That these are the things to show them. The students must understand that this is the gallbladder with pointers and everything. Did you edit it properly?
No, they
Or do you have
a
a plan to do it later on? Maybe if you can do that, maybe it will be more helpful. Thank you.
Thank you.
I too would like to congratulate you. It must be a great thrill to come here as a medical student and present in front of people from all over the world. And you did a wonderful job, so congratulations. I think that the use of laparoscopy to teach anatomy is a wonderful opportunity. We run a program where our final year medical students that are going to do a career in surgery, just before leaving medical school, have a course called Anatomy for Surgeons. And much of this is given by laparoscopy videos. And after the introduction of that, it really increased their enthusiasm. It was too late in their development to encourage them to come into surgery because they'd already chosen it. But I think when we see them coming into our residency program, their anatomic knowledge is much better than it was in the past. And it's real, it's relevant to them, it's real pictures, it's not drawings, it's not cadavers. And I think this is very, very good, and congratulate you again for making such a good presentation.
Thank you.
Any other discussion?
Okay, thank you very much, promising young future doctor, Agarwal. Thank you.
I'd like to move on the next presentation, which will be presented by Dr. Tajuo Nambu from Japan.